I'm honored to be here today, and I look forward to having a discussion with you about this. Really, it's an emerging area of research. There's probably more questions than there are answers, but hopefully it gets the whole room thinking. And also, just as a short introduction, I was not aware of what the setup in this room would be like. I was not aware that there would be standing tables and so on. But just to point out to you the magnitude of the problem that we're talking about is we've just heard a 20, 30-minute talk on the problems of inactivity, and you're going to hear more this day, otherwise you wouldn't be here. But look at the fact how easy it is for everybody to remain seated where they are now. There are multiple reasons for that. This is not a trivial problem, and the solutions should not be trivialized. I oftentimes like to remind people that in any good sporting event, the coach will tell the team, if you're in the first quarter, it doesn't matter whether you're up 20-0. The game's not over. It doesn't do science justice when we pretend like this is a simple solution and we can have very easy fixes. They may seem easy to us as creative people, but sometimes what is obvious to us might be obviously wrong. So I want to remind everybody that in this little niche that we have that we call inactivity physiology, we have that just simply because we already know what exercise physiology is. That's a well-established discipline. Every major university, in fact, probably every minor university in the country has a degree plan in it. There are professional societies, multiple professional societies. There are multiple textbooks. There are multiple degree plans everywhere you look. Yet, there's really only a single chapter in a single textbook that I'm aware of that talks about inactivity physiology. So that gives you a sense of the state of the art. So what are we talking about? There's several simplistic ways of summarizing it. One is that sitting too much is not the same as exercising too little. I'll go into that and I'll show you some very recent data, both at the behavioral level as well as at the physiological and molecular level, that these are two distinct things. An implication of that is profound. As important as exercise is, and we all can acknowledge that because of decades of research by people like Steve Blair. But now what we're saying is that there's something else. There's another lifestyle factor. And that exercise is likely to not be the perfect antidote for a sedentary population. And I'm defining sedentary as a Latin root word might lead you to believe. Sedere means to sit. Also, another concept that I'm going to introduce you to is that for many of the key molecular mechanisms at the very root cause of chronic diseases that are caused by inactivity, generally sitting, sometimes reclining when we're awake, the study of inactivity physiology may provide us with more specific and more potent answers than even exercise physiology. You are all welcome to email me, and I can give you PDFs. These are just a listing of some of the articles where we've developed this concept. So you can see, beginning a while back, we began talking about how inactivity might be different than exercise. So I'm going to lead you through just a few examples, and there really aren't that many in the literature at the physiological level. But in the last 5 years, there's been an emergence, a major boom in the epidemiological observation research. So I'm only going to touch on the epidemiological work today, but I'm going to describe some of the physiology work first that led us into thinking about this. So one concept I've already introduced you to is that exercise physiology and inactivity physiology really are two different things when you start to look inside of the body. What's happening to me and what's happening to you right now, there are differences physiologically between the two of us. You're sitting at rest, and I have a very light level of activity. I see some people who might be moving around in the back of the room even more than myself. That is different than whether you go to the gym this afternoon and do a 30-minute jog. So we wrote in 2004 that there might be qualitatively different processes regulating some of the proteins and genes that determine your health. And sometimes there's a very high level of sensitivity to the way your body responds, even in a rapid, even in hour time frame to sitting. So I'm going to give you an example that led us into this, is that I had a grant and I was studying how exercise regulates a gene called lipoprotein lipase. It was a study where I wanted to determine the underlying mechanisms that exercise might regulate lipoprotein lipase. But we were disappointed because we were doing rat studies and we were very challenged to find a model where we could actually increase the functional enzyme activity of lipoprotein lipase in the animals. So what it did is it led us to say we were looking at animals when they were in their cage just standing and milling around, and we saw a remarkable effect of that on the regulation of this enzyme, and that's what I'm going to show you next. So put simplistically, you can think about this enzyme as the vacuum cleaner for fat in your bloodstream. It's absolutely essential, according to very good studies, either knockout mice models or studies using antibodies in non-human primates, that this enzyme is critical for the removal of fat from the blood. Also, it's essential for making HDL cholesterol. Animals, when you knock this out, they do not have HDL cholesterol. You take monkeys, you give them an antibody to this enzyme, and their HDL cholesterol plummets within hours. So this is the key figure that led us to convert from being exercise physiologists to inactivity physiologists. Notice this difference here. This was the finding that we had in the late 1990s, and it shocked us because we knew that pharmaceutically you could have maybe a 20% increase in this enzyme at best. We knew that with disease conditions such as aging or obesity, type 2 diabetes, you could have maybe a 20–30% decrease. Those are not trivial effects. There are dozens, literally hundreds of studies that have reported that magnitude of effect and associated with risk factors for disease. So when we saw that this enzyme was virtually wiped out by inactivity, it shocked us. More shocking is it took hours, not weeks, not months. So we followed up on that in a series of studies. We showed using radioactive tracers that no longer could the fat enter to the skeletal muscles that normally have a high level of this activity. And we also showed, as expected, a drop in HDL cholesterol within hours. So one of our papers, the title kind of tells it all, is that we said understanding this is a molecular example, molecular reason to maintain daily low-intensity contractile activity. I said maintain because that is something that we are doing to some degree already. And that's one of the beauties of this, is unlike exercise training where you take an unfit person, you introduce them to something that's rather unique to them, they get hot, they get sweaty, maybe it doesn't feel good to them. We're talking about something at a very low intensity that all people, anybody who's able-bodied, experiences, and for hours per day. So with this data, I want to point out another important point, is that you can see this naturally very high level of lipoprotein lipase activity in animals. These are just control animals standing in their cage, not given running wheels, not given a treadmill. When made inactive, Within hours, you can see it's knocked out. We've repeated this dozens of times in multiple studies, and we've shown the mechanism for it, and I won't get into that today. But it deals with local contractile activity within the skeletal muscles. In the exact same type of animals, we can do all kinds of vigorous run training programs, and we're unable to have the exact opposite of that effect, which is raising the lipoprotein lipase in those same type of muscles. In humans, we see a similar type of thing. I'm just going to show you data from a recent paper where we took biopsies in people on multiple different days, and in this crossover type design, we had people doing different behaviors. The point that I'm going to make here very quickly is simply that lipoprotein lipase in the muscle is highly related to blood lipids, as has been shown before in the control condition. But when the individuals exercised, they could improve their blood lipids to some degree, but they could not improve the lipoprotein lipase levels. And so, in other words, what we found essentially was that this enzyme was playing a critical role in regulating your health as a result of light activity, but it didn't seem to be the exercise mechanism. I won't go into more detail than that for this paper. So all of this made us revisit the epidemiological literature. People would often ask us, they would say, well, it's great you've got these animal models. It's great that you can now unplug some of these powerful mechanisms that happen in the body. We're going to fund you for that, but you irritate us when you have that little significance section in your grant and you say this might apply to human health. After all, that's what the significance section is for, right? Well, so we looked closely at the epidemiological literature, and at the time, in the early 1990s, or I should say late 1990s, early 2000s, there really wasn't a literature that was devoted to this. But we looked at the classical paper that many of you might be aware of by Jeremy Morris. This study was performed actually in the 1940s, published in the early 1950s. What Dr. Morris showed, very simply, was that individuals who have vocations that by the nature of the job, they have to sit to work. Those individuals had roughly twice the rate of death from heart attack in middle age compared to their coworkers who had vocations, maybe even working right next to them, within literally feet of them, exposed to a similar type of environment after work. The only difference was that these workers were up on their feet when they were working. So it's kind of ironic that Dr. Morris's study was classical for one of the reasons why we exercise. Yet really what Dr. Morris showed to me more, in revisiting it with a different perspective, was he showed that people maybe with sedentary vocations are working in a more hazardous situation. After all, in the 1940s, there were very few people who did leisure time physical activity. And I can also tell you that the individuals that were more healthy, in other words, the conductors in these studies, were unlikely to probably meet the current recommendations for physical activity. A very recent study was published that used objective measurements, still not perfect, but they were using accelerometers on the hip. So while it doesn't measure sitting per se, it at least gives you an objective measurement. As Dr. Blair pointed out, self-report of exercise is crummy. People over-report it. Self-report of sitting is especially challenging. I don't need to tell you that it's self-evident that you don't know how much you normally sit. And if you tried to guess, you could probably, get a reasonable number, but you might be a couple hours per day off. And so the problem of misclassification is enormous. So I've been waiting to see some studies come in the literature where they start to use accelerometry. Again, it's not a perfect measurement, but it's better. And as Dr. Blair pointed out, when you use a more precise measurement of the risk that you're exposing yourself to, you're going to have a better outcome if there's a true effect. And this is what this study showed, was that the relative risk, or I should say the hazard ratio, of people in the quintile who sit the most was over 10-fold greater for mortality than individuals who sat less. That's phenomenal. In that same study, while being a small study, they also adjusted for a variety of measurements, including moderate to vigorous physical activity. And the significance was still well over 5-fold. So, one of the questions that we've asked is we take this average American now who's already not exercising, and we ask, can they be more unhealthy if the trend for a more sedentary lifestyle gets even worse? So let me illustrate this. If we plot by percentiles, and in this case we have it by quintiles, in fact this is Dr. Blair's data, you can see that the average person right here in the median has more risk for death or for disease than an individual who would become more fit. But as Dr. Blair has pointed out, the big public health problem lies in here, at the steep part of the curve. So if this individual is not exercising, how can he become more sick? How can the burden of public health become worse? By exercising less? He's already not exercising. So one of the tenets of inactivity physiology is for the concern of the future. We have not reached the bottom of the barrel of unhealthiness. This is not a trivial problem. So, one of the concepts that we've come to really appreciate, and this is a result of an enormous amount of research, is that time becomes an important variable, not just the calorie, not just energy balance, but time. A very simple yet elegant way to explain it is incontrovertible. Every minute of the day, the cells in your body are living. They are sensing the environment. If I hold my breath, every cell in my body within a minute's time will know that it's deprived of oxygen. If I heat my body, every cell in the body will know it. So, what we postulate is that the whole day matters for human health, not a 30-minute sliver out of a 1,440-minute day. The whole day matters. So it at least makes it plausible that what we're talking about could be incredibly important for human health, because we're talking about signals inside of the cells of our body throughout the day having effect on multiple physiological processes. So if you've ever seen a doctor show, you know that when you see a flat line, it must mean something bad. You know that there's going to be some doctors and nurses scurrying about, running into the room, and everybody's going to get nervous and noisy. So flatline signals are bad in medicine. I know that. So we like to measure the equivalent of the ECG on the leg muscles. It's called EMG for muscles. Where's the flat line? So if every minute of the day matters, then maybe that does matter. We've also used technologies called microarrays, where we can now look at literally the expression of every gene in the body in any tissue that we biopsy. This is not new, but at the time that we did it, it was. So in the early 2000s, we started looking at inactivity. Just a snippet of that research showed us that very rapidly, within hours, there was a change in the homeostasis of hundreds of genes of many different functions. And so what this led us to was to think carefully about what might be the signals, what might be the solutions. And there's what we call the Specificity Principle. Again, it's a very simple principle, and you could think of a lot of analogies, but it simply says that the signals harming the body during physical inactivity are very specific and very distinct from exercise. So that's one reason why we say simplistically, too much sitting is not the same as too little exercise. I'm going to give you a recent example of a paper that Ted Zederek, who works in my lab, just published. And he showed that he was very interested in hemostasis and coagulation. And so this is also an example of where inactivity physiology, while it's a new and emerging field, is opening the doors to answering questions that have been around for decades that we haven't solved. In this case, we were looking at DVT, deep venous thrombosis. We've known about DVT for a long time. It really became a major problem during the London air raids when people had to get under the bunkers and they would have to sit idle for hours at a time. You might know about it if you're an international traveler, and they call it coach syndrome. You might know about it if you've ever broken a limb or broken a leg, not an arm, but a leg, or if you've had a hip replaced. Your orthopedic surgeon was probably warning you about DVT. It kills people. It's very serious. It's now been reported in not only the medical literature, but now in the courtroom, it's becoming an issue. Employers have literally been sued because they have people who are computer programmers or sedentary jobs that get DVT on the job. That's why airplanes warn people, try to move around a little bit and so on. Yet, of course, we all know that the stewards and stewardesses throw us back in our chairs. So what Ted did was he used the microarray technology again, and he looked at all of the genes that were expressed in muscle that have a role in hemostasis. He identified 17. Of those, he wanted to say what's the most robust expression with regards to both humans and animals in the leg muscles, and how it might be affected by physical inactivity. He identified one gene that met those criteria, lipid phosphate phosphatase, LPP1. What Ted showed was both in rats and in humans, vigorous exercise was not enough to prevent this gene from becoming downregulated during these models of inactivity. So we did it several ways, but the bottom line was that hard, vigorous exercise did not raise this important gene expression, but inactivity lowered it. And then he showed that it was sustained at a lower level during continual inactivity, in this case by having an individual in a wheelchair. However, at least an hour a day of vigorous exercise was not enough to provide an antidote to this problem. Furthermore, we tested individuals who were habitually exercise training, very fit, and we showed the exact same kind of responses. So, there are people, maybe some of you are like this, you're an exercising couch potato. You might spend many hours a day sitting to work, many hours a day sitting in your leisure, but then you get up, rarely, but occasionally, throughout this day. And the question is that exercise enough, or do we need to think about another lifestyle? So we ask the question, are exercisers less sedentary? If you look at the whole day. So we designed this study in a way that we thought we would show an effect because we picked middle-aged to elderly women, 40 to 75 years of age, who, as a result of their exercise, was walking. So we figured it wouldn't be like maybe a younger person who would go out on a very hard bike ride that would just blow themselves out. They'd be exhausted for the rest of the day. But they would do moderate-paced walking. So we want to know, are they less sedentary if they meet the current recommendations? The conclusion was that exercise did not make them less sedentary. So real briefly, let me show you some of the data. Again, this is an observational study, and so we stratified the women according to 3 levels of moderate to vigorous physical activity in sustained bouts of 10 minutes or more, as is currently recommended. So you can see the 3 groups for their total weekly exercise time. Remember, this is walking. And yet there was no difference in either their sitting time, standing time, non-exercise stepping, but of course there was for the exercise. Then we looked at the ladies on days when they did and did not do their exercise. And again, even on the days they exercised, there was not a difference. So this is leading us to appreciate the low-intensity physical activity that's generally intermittent and throughout the day, and the balance of that with sedentary behavior. All of the existing recommendations on how to exercise dose questions say explicitly that the exercise should meet a threshold of 3 METs or moderate, preferably vigorous intensity. This is by American Diabetes, American Heart, ACSM. Low-intensity physical activity is explicitly said. This is not what we would call health-promoting physical activity. Those aren't my words. Those are the words that are written in the guidelines. So, there are very important implications for this inactivity physiology paradigm. One is, and the reason we really got into it, was we were interested in what do you do for the people who can't exercise. Now, while we understand that we could probably come up with some kind of program for everybody, there are many reasons why some people can't. Most people say they won't, they just refuse to do it. But again, that's important to understand and appreciate too. Also, we're interested in those who do exercise. Is there something else we can add to your lifestyle that's important for you? My kids, when they come home and I say, have you had your vegetables? They say, no, but I had an apple. Well, that's not right. That's not a specific solution to the problem that you need to get your vegetables. But they're both nutrients, they're both good for you, right? Apples are good for me. And I said, yeah, exercise is good for us. I don't deny that. I exercise every day. I enjoy exercise. Many people don't. So, what do? Well, we say there's something else. Even for those who do exercise, there's something else to promote good health. This slide has been around for a long time. I've used it many times, and unfortunately, it's perhaps been misunderstood sometimes as well, especially in the media. The reason why we use this slide is we want to make the point that decades ago, nobody ever challenged whether sitting too much was hazardous to your health. In fact, 10 years ago, nobody would say that. So we said it's an insidious hazard. It's something that's real, but it sneaks up on you. It seems benign. Everybody in this room who's currently sitting or is going to go back to their office and do it, you can say, well, everybody else does it. We feel comfort in numbers. That's understandable, but it's also foolish. Smoking, secondhand smoke, are great examples where at one time everybody did it. There was actually some controversy about whether it was unhealthy, and now you can see what's happened to people who smoke. They've been ostracized and so on, and it's actually been legislated out. We do not want to take this analogy that far. Sitting is more like eating. It's something you have to do every day, and you're going to have to do it throughout the day. So again, like I said in my introduction, solving the problem is not trivial. If I could abstain completely from drinking or from smoking, that might be easier for me than just cutting back a little bit. So, I'm going to leave you with this concluding thought, is that we do not have evidence-based guidelines because we do not have sufficient data right now to inform us on dosage and those type of questions. The media is very interested in providing folks with solutions. I'm a very hopeful person. I believe that we're going to find these solutions, otherwise I wouldn't be working at it. But that we don't want to rush out and allow ourselves to get ahead of the game. We're in the first quarter. Sometimes it does science a disservice when we proclaim that because we've identified a hazard, that the solution is now here. Oftentimes what I hear in the media is, take a 1 or 2 minute break every hour. What's the problem with that? We're already doing that. I could show you data in literally hundreds of people where we measured every step in the day, every standing bout, every sitting bout. We've done it hundreds of children, we've done it hundreds of young adults, hundreds of old adults, and every case, we see that everybody is up at least a couple hours a day. And so we are doing this behavior. The question is, how much more do we need to do? So if we tell people 5 minutes is enough, take your little standing break, have a standing office meeting, something like this, we may actually be fooling ourselves, and I think doing a disservice. The public is tired of being told, especially in the nutrition literature, drink coffee, don't drink coffee. Eat carbohydrate, don't eat carbohydrate. Eat fat, don't eat fat. We don't want to make those same mistakes. We have a pristine opportunity here to get it right before we make these widespread proclamations to the public. Thank you.